Well, good afternoon. 5 weeks ago, I spoke to you from this table, and I told you that we were seeing some very troubling projections from our public health experts. The COVID-19 variants that arrived through our borders were spreading rapidly and being identified across the province. Our ICUs were overflowing, and hospitals were close to being overwhelmed. Our healthcare system was at a breaking point. I told you that as Premier, I would make the tough but necessary decisions to save lives and ensure our hospitals didn't collapse under the strain of these new deadly variants. We put in place strict measures to immediately stop the spread of this virus and give ourselves time to roll out more vaccinations. I know that these measures came with a great price, but speaking to you today, I can say that these measures have worked. Collectively, as Ontarians, we have saved thousands of lives, and that is thanks to your sacrifices. Today, we're seeing increasingly positive trends in key public health indicators. As a result, we're now in a position to look at a slow and measured reopening of the province. And working in lockstep with our public health officials, we have created a plan to safely reopen in the coming weeks. This is being done slowly and with extreme caution. That is the only way it will work. And it will be done through a gradual, three-step roadmap to safely reopen Ontario. Similar to the UK, Quebec, and Saskatchewan, we're taking a gradual and phased approach based on hitting vaccination targets. Minister Elliott has done a tremendous amount of work on this, and she will take you through these details very shortly. But it is absolutely crucial to understand how this plan will work and why we've moved in this direction with a phased three-step approach. The reality is, COVID-19 remains a significant threat to us. New variants continue to enter the province every single day. But our vaccine rollout is accelerating at an incredible pace. We continue to set new daily records for doses administered. We have lowered eligibility to anyone over 18 across the province, and almost 60% of adults have received their first shot. But the speed at which we get through this reopening, we will come down to one thing: how quickly we get people vaccinated. And we all have a part to play in that. If you haven't received your vaccine yet, please go and get it now. If you have, please encourage a friend, a family member, a neighbor to get theirs, because that daily vaccination rate is the single biggest factor in our fight against COVID right now. It's how we can start to look forward to a great summer. But we won't risk a new surge in cases that could come from new variants getting into our province, because we know too well how fast the situation can change when these variants are in play. This is why I continue to call on the federal government to do more to secure our borders. And we know the difficulties India is having right now. Just this week, we sent a second shipment of ventilators. That's going to be totaling 5,000 ventilators and oxygen supplies to help them fight against this virus. As long as the federal government keeps our borders unprotected, as long as 1/3 of air travelers are allowed exemptions from mandatory quarantines with no explanation why, and as long as thousands of people every week walk across our border to avoid hotel quarantines, we remain vulnerable to new variants entering the province every day. We risk a fourth wave. So we must approach this in the most careful and disciplined way. But I know above all, you want certainty right now. You want a plan that you can count on, a transparent and predictable plan to take the guesswork out of your daily lives. And that's what this framework is designed to do, to provide certainty and predictability. And I know that there might be some people who want to move faster, but we can't risk it right now. But thanks to your efforts, we can begin with opening most outdoor recreational amenities starting this Saturday, May the 22nd. Minister Elliott will tell you more. But I want to say something before I hand it over to her. Folks, we've been through so much the past 15 months. It has been the most trying time many of us can remember. Everyone has made tremendous sacrifices, and we have all felt the impact of this pandemic. We're in a better place right now, and that's the result of your commitment to keeping each other safe and getting vaccinated. We can't risk undoing the progress we've made. Too much has been lost to do that right now. I know the weather is great. It's the long weekend, and you just want to get back to normal. But please keep following the guidelines closely. Stay vigilant and stay safe. We're not done with this pandemic yet, but we will get through this if we keep working together. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon, everyone. As the Premier mentioned, thanks to the collective efforts of Ontarians who continue to roll up their sleeves and follow public health advice, we continue to make progress in our fight against COVID-19. While now is not yet the moment to reopen the province, today we are releasing our roadmap to reopen. The roadmap represents a way out of the pandemic and provides a clear path forward on what will be carefully and safely reopened and when. It includes 3 steps based on the province-wide vaccination rate and improvements in key public health and healthcare indicators. When it is time to exit the province-wide emergency break, we will begin first with the settings that we know are the safest. Step 1 of our roadmap has an initial focus on resuming outdoor activities with smaller crowds, where the risk of transmission is lower, along with permitting retail with restrictions. This includes allowing outdoor gatherings of up to 10 people, outdoor dining of up to 4 people per table, and non-essential retail at 15% capacity. With restrictions in place, this would also include outdoor activities such as pools, splash pads, fitness classes, zoos, and religious services. Step 2 would further expand outdoor activities and resume limited indoor services with small numbers of people and with face coverings worn. This includes outdoor gatherings of up to 25 people, outdoor sports and leagues, non-essential retail at 25% capacity, public libraries, and personal care services where face coverings can be worn and with capacity limits. Step 3 would expand access to indoor settings with restrictions, including where there are larger numbers of people and where face coverings can't always be worn. This includes, but is not limited, to gyms, cinemas, performing arts facilities, indoor dining, and museums with capacity limits. As mentioned, any decision will be made with the utmost caution. The province will remain in each step for at least 21 days. This will allow us to evaluate any impacts on key indicators and determine whether the province is ready to safely move to the next step in its plan. Based on current trends in key health indicators, we expect to enter step 1 of the roadmap around the week of June 14th. Over the coming weeks, our government will continue to work with businesses and sector partners to ensure a clear understanding of when and how they can begin to safely reopen. With this roadmap, it's clear that there are brighter days ahead, and there is hope for a more open and safe summer. This starts this Saturday, May 22nd, with the reopening of outdoor recreational amenities such as golf courses and tennis courts, helping Ontarians to safely celebrate the long weekend. Outdoor gathering limits will also be expanded to 5 people. As we continue down this path, I encourage everyone to roll up their sleeves to receive the vaccine and continue following public health advice. We're almost there. Thank you.
We'll go to the phone line for questions. First question, please.
First question comes from Randy Rath at CHCH TV. Please go ahead.
Hi, Randy.
Hi, Premier Minister. I'm wondering, when you start to offer AstraZeneca, the reserve that we have, and the new shipment that's coming soon in the next couple of days, I assume, as a second shot for people that have had their first shot of AstraZeneca, are you going to require people to sign some sort of waiver or something like that before they can receive that second shot?
I'll hand that over to the Minister.
Well, thank you very much for the question, Randy. That determination has not yet been made. We are waiting for the final recommendations from Dr. Williams and our medical experts on what we should do with the AstraZeneca vaccine. Although we do know already that data from the UK indicates that any problems with the second shot are far less than any problems with the first shot, and that there's also evidence that the first shot of AstraZeneca can also be replaced by one of the mRNA vaccines such as Pfizer or Moderna. But perhaps Dr. Williams would like to speak to this point more specifically. Thank you.
Yes, well, thank you. And as Minister Elliott has said, our team is meeting and we're getting the data. As I said the last time, we want to make sure that we have the most current up-to-date data on the AstraZeneca for second dose. From the different sectors, are looking for some more updates. The main thing when you ask about that form and the term we use is informed consent. That can be verbal, especially if it's a physician giving it, and they usually ask you, even if you're getting any vaccine, do you have any questions, issues, or concerns, whether it's the Pfizer, whether it's the Moderna, or whether it's the AstraZeneca. And that's we want to make sure that if you're going to make a decision, you have an informed consent in that process, and your questions are answered, whether it's on fact sheets before you go in, or whether it's at the site to ask anything specifically to the person doing the vaccine, whether it's pharmacy, primary care, or otherwise. So we feel confident at this stage that we hope to be moving fairly soon on ensuring second doses available for people for AstraZeneca. And we want to make sure the data that you have, our physicians have, pharmacists, as well as our mass centers, is everything that you need to do to make the right decision, and that we can assure you that it's a safe undertaking to do, and you get the best coverage. And as the Premier said, the main thing is to get vaccinated as soon as you can, and to get if it's a second dose in time, and the right timing and stage of that is also important, especially with the AstraZeneca. We want you to get the best protection you can as soon as you can.
Follow-up?
Okay, and I think the question that's on top of everyone's mind right now for the Premier is there any possibility that schools are going to go back this spring?
Well, right now, we have some differing opinions. Dr. Williams, which I always chat with, he's in favor of opening the schools. We have a few doctors on the science table that aren't in favor. Then we have the teachers that want to put an injunction in if we move forward. So we just have to get around the table and make sure we have agreement on this. And I know a lot of parents are anxious, but there's also the fact that you heard this morning through Dr. Brown and Dr. Williams that it could possibly increase cases by 11%. That's concerning with me when it increases 11% because it compounds so quickly.
Next question.
Next question from Colin DeMello at CTV. Please go ahead.
Hi, good afternoon, Premier. I just wanted to pick up on the school question. I mean, you're expressing a desire, or some are expressing a desire to see kids back in the classroom. I don't think parents would be happy, though, if stores and patios are open before schools. So I'm just trying to get a timeline here in terms of a window. Will schools open before the first step? Is that the possibility?
Well, Colin, thanks so much for the question. Again, we have to get a consensus from all the doctors. All the chief medical officer, we know his point of view, and other local medical officers. We have to get consensus off the science table. A few of their members came out this morning and said that they weren't in favor of. And again, we have to deal with the teachers that are saying that they would possibly put an injunction in, which they had threatened back in I think it was February or March, if I'm not mistaken. So I just want everyone to have a consensus. But really, Colin, what I'm mostly concerned about, when I heard Dr. Brown say it's going to increase cases by 11%, we can't afford an increase of 11% right now.
Follow up?
Premier, the one thing that's lacking in this plan here is what happens if there is a sudden and dramatic surge in cases after we enter this roadmap. Is there a scenario in which we would have to move backwards at all?
Well, my biggest concern, Colin, is these variants that are coming in through the border. I've put in numerous requests. I've been out in public asking for them to tighten up the measures. We sent 4 letters. We know cases are coming in on a daily basis at the airport. And you know, 15 the other day, 10 the other day, and they all add up. And then we have thousands of people bucking the system, not staying in hotel quarantine, and just walking across the border. So that's extremely concerning. I just encourage everyone, please go get a vaccine. What we're seeing right now, vast majority of people in the hospitals are the people that aren't getting the vaccination. And that's holding us back. Like, folks, please, if you have a friend, you have someone hesitant, you have a family member hesitant, please, I'm begging you, go get a vaccine.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. For all the people who are wondering about timing, we understand there's no firm timing on these measures. It's tied to vaccination levels. So when would you expect, at current rates or predicted rates, that we would get to 20% fully vaccinated, which would allow haircuts, and 25% fully vaccinated, which would allow indoor restaurant dining?
Yeah, great question, Rob. Before I pass it to the minister, you know, Rob, I have to give a shout out to the people at these vaccination clinics and the mobile units and everyone and the companies that are coming forward. Folks, it's staggering when you sit down and think of the numbers. You know, we're doing anywhere from 140 to 150,000 a day. To put that into perspective, first of all, the geographical area of Ontario is absolutely massive. The 15 million people in Ontario, which is huge. But I sat back and I calculated in my head, at that rate we're doing, think of this, we're doing over 3 in a bed every second, 3 vaccinations every second, 200 every minute. Those are huge numbers, 12,000 an hour. 144,000 in a 12-hour span, and you go by, and a lot of people have obviously went by, 7.5 million people. You know, just the people putting the vaccines into the syringes, those people deserve a gold medal. They're sitting there tedious all day, putting it in the syringe, getting it ready, and the logistics is massive. And I just want to tell you from the bottom of my heart, I want to thank each and every one of you for working your back off. I want to thank the people for going out there, getting vaccinated. You're all absolute champions. It's amazing how they're going around the clock 7 days a week. So thank you. I'll pass it over to the minister.
Well, thank you, Premier, and hello, Rob. The movement from one category or one step to another within the roadmap that we've set out is based on vaccination rates as one part of it. And we know that we need to have at least 60% of people vaccinated to move into the first step. We're already at 58%. We should be at 65% of all Ontarians well before the end of May. But we also look at other issues such as the numbers of new cases, the number of hospitalizations, the number of people in intensive care, the R rates, the public health capacity, and so on. So we are looking at a range of indicators, and we know that we need to stay in one level for 21 days, which is it's certainly in line with what's happened in Saskatchewan, for example. They're using that 3-week time frame as well. In the UK, it's 5 weeks. But we also know from the modeling that's been done by Dr. Brown and the medical experts that the timelines and the frames that we've set up are both realistic and achievable. And so that's what we're following. We're following that modeling advice and setting realistic targets that we will be able to achieve so that people will be able to have a safe and good summer.
Follow-up?
Okay, thanks. I'm just going to try asking that again because maybe my question wasn't understood. I was asking, given current vaccination rates, when projected vaccination rates as we get more vaccines, when would we expect to be at 20% fully vaxxed and 25% fully vaxxed? Because that's going to help people figure out roughly when they're going to be able to get a haircut or begin indoor dining. You know, also bearing in mind these other factors like case levels, ICU levels, and whatnot.
Yeah, good question, Rob. And you know, it all depends on the vaccines that we're getting, and we're getting a good amount right now, depending on how much the output is, and they're doing extremely well. I can't give you an exact time, an exact date, but it's a few weeks away. If we do the math, we're at 60% today. We'll hit 65% before the end of the month, a few days before the end of the month. Hopefully, we'll hit 70%. As we're doing that, simultaneously, we're still giving out the double doses. I think the other day they told me they gave out 15,000 of the double dose. So we're going to start moving quickly as we get needles into people's arms, and we'll get it moving. Maybe Dr. Williams, you want to talk about that for a minute? I just wish, Rob, I wish I could give you an exact date. I just can't. It depends on the volume.
And I think the Premier is correct. I mean, at our public health measures table, we understand there's supply and demand, and the people showing up and getting those vaccines in the arms, as well as the first dose and second dose. And you have to allow 2 to 3 weeks for both of them to take effect to give some maximum potential there. So it doesn't happen instantaneously. So we have that time, we have to allow that to take effect. And we're seeing that now. Even with our first dose going out, we're seeing our numbers dropping. We're seeing our percent positivity coming down. We're seeing even our hospitalizations, talking to Ontario Health, the numbers coming in are dropping, as well as the severity is dropping. So this shows success all across the board, knowing that the one dose gives you protection usually against severe consequences, as in death or severe hospitalization, not always against transmission interruptions. So that's one of our main concerns, why we want to have the metrics both with the first dose and the second dose. When we achieve that, we'll have a better idea on that. And as Minister Elliott's already alluded to, that will match up with other metrics that tells us it's not only vaccination, but our other ones, it's having impact on the other ones that are critical to assess our system performance.
Next question.
Next question from Laura Stone at the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. What do you say to people who think that this plan is too slow and want you to go faster? I mean, the first step of this is 60% of adults with one dose, and we've essentially achieved that. So why are you not reopening at least some of these outdoor activities like patio dining and retail at a very low capacity? Why are you not doing that right now?
Well, thanks for the question, Laura. Exactly what Dr. Williams just mentioned, that it takes a couple of weeks to get into your system, 2 or 3 weeks. So that's what we're waiting for. And I know a lot of people want to move quicker, but let's look where we were 2 to 3 weeks ago. We were maxing out on our ICUs. We had to get a runway to get more vaccinations, and in a couple of weeks we were able to vaccinate over 2 million people just based on the great work the frontline healthcare workers were doing. So that allowed us the runway. We're in much better shape now. We're slowly seeing the ICU numbers come down, the vaccinations go up. So that's where we're at. There's no one, all three of us, we all want to open up a lot sooner, but we can't. We have to be cautious, and let's move slowly. But it's really good news, and I want to thank the health table. I want to thank the science table. You know, they've worked so hard, but the person to the left of me right here is amazing. Christine has done an incredible job working closely with the health table and all the doctors, and everyone's come up with the same consensus. Let's move slowly, but the great news is people are going to be able to launch their boats. They're going to be out golfing. They're going to be able to play sports. They're going to be able to gather with five people outside their family. So this is really good news. And again, I want to thank Christine. I want to thank all the docs. And we're all grateful for it, but we'll move cautiously.
Follow up?
And what about people who are looking down to the United States and thinking, wow, you know, they're basically fully reopened now, and Canada's about to move ahead of the U.S. on first doses, obviously not second doses. What do you make of that comparison? What do you tell people who look down to the States and think, you know, maybe we should be thinking of doing something like that here?
Yeah, well, first of all, let's use Florida because everyone loves using Florida. And by the way, I think Governor DeSantis is doing a good job. He's working hard. But let's put this into perspective. First of all, if we were able to get the vaccines like they did a couple months earlier, even 3 months earlier, we'd probably all be doing the happy dance out in the streets right now. Unfortunately, we weren't able to get the vaccines. We're getting them now. And look at the population of Florida. They're approximately about 40% larger than Ontario, but their mortality is 400% more. Unfortunately, we have a little over 8,000 mortalities, and every one of them is terrible. They're up to like 37,000, 38,000. You even deduct the 40%. They have cases 400% higher than what we have, taking into consideration they're a little larger. So, you know, I would rather have less mortalities and wait a little longer and then move forward cautiously. And we're going to get there. We will get there, but keep in mind they were able to get the vaccines a few months earlier.
Last question.
Last question from Graham Richardson at CTV Ottawa. Please go ahead.
Hi, Graham.
I just want to be clear on this for everyone. So it's along the lines of, I believe, what Colin was asking. But we're already at 60%. So the next stage, is it possible it will click in before middle of June or not? Is that a hard date, mid-June?
Well, stage one, we're looking at approximately June the 14th, 15th, somewhere around there. As Dr. Williams mentioned, once we hit the 60% or we hit the 70%, we have to allow 2 to 3 weeks after that as well. I'll pass this over to the minister, but that's what we're gearing up for roughly.
Well, thank you very much for the question. And we are trying to give approximate dates so that we can give people a level of certainty to the extent that we can. But because there are a wide variety of metrics involved in addition to the vaccination rates, it is possible that we could reach that the level of getting to stage one before June 14th, but we're just giving that as an approximate date right now. But the sooner we can get more people vaccinated, the sooner we're going to see things like case rates go down, hospitalizations go down, intensive care units not be as full as they are. So we want everyone to please work with us, get vaccinated. Please work with your families and friends and convince them to get vaccinated too, because that's going to make all the difference to us having a much more open summer that we can all enjoy.
Follow up?
And Premier, I don't understand the schools. You've always had governments generally have always had a contentious relationship with teachers' unions. You keep coming back to this, that they're going to bring an injunction into court. I mean, the teachers' unions don't open schools. Governments do. The education minister does. So if there isn't a consensus, are you writing off the school year? Because hundreds of thousands of parents need to know whether their kids are going back or not. The numbers, it appears, look to be much better than they were a few weeks ago, and you're never going to get a full consensus from teachers' unions, especially with a conservative government, as you know. So is it time to just say, I'm going to make a choice because I'm the government? Because I don't know that you're ever going to get a consensus from the group you keep mentioning.
Yeah, excellent question, and I hear you. And you know something, I feel it. I have there's tons of kids on my street. They'll come up to me and say, "Oh, you know, when can we go back to school?" and so on and so forth. The news I just received, actually I received it yesterday, is very concerning. The 11% increase. Right now, can we afford the 11%? I still want to get approval from all the docs, the consensus. And yes, I agree with what you're saying, the teachers, not that it's a conservative government, NDP, Liberal and Conservative, but here nor there. You know, I would love to get the kids back. I want to make sure we also get the kids vaccinated, which we're going to be doing at the beginning of June, and hopefully we'll have all the kids with their first shots in the first 30 days of June. So that plays a factor in it as well. So we're working closely with Minister Lecce. He's doing an extremely good job. But let's just, I'm not going to rush into this. Let's just see over the next little while, short period, and then we'll give certainty to the parents. But I fully understand. I talk to the parents every single day. Last note, folks, on a lighter note, you know, the big games tonight, the Leafs and Canadians. So I called my buddy Francois Legault, and he's a great guy. We're good pals. I think the world of the guy. And we usually put a little wager and every single game. So text him this morning, you want to put a wager down. Well, you have to wear a Canadian shirt. I have to wear a Canadian shirt if we lose the series, and you have to wear Leafs. This is the only time my buddy Francois won't bet me now. What does that tell you, folks? You know something? That's great. So all I have to say is go Leafs go. And I love Matthews and Marner. Guys, get the Premier a couple goals tonight for me. Thanks. All the best. Go Leafs go.
Thanks, everyone.
Yeah.